A new initiative in Singapore will see traditional Chinese medicine like acupuncture complementing Western medicine in inpatient care. The partnership between Tan Tock Seng Hospital and a local university is part of a broader effort to bring Eastern and Western medicine together within the country's national healthcare system. This was announced at the Singapore Health and Biomedical Congress, and Rebecca Mateo has the details.
60-year-old Tan K. Chuan is on the road to recovery after a stroke in July this year. He is now receiving acupuncture twice a week as part of his rehabilitation. Patients like Mr. Tan could soon see traditional Chinese medicine being included as part of their treatment. That says Tan Tock Seng Hospital is working with Nanyang Technological University to explore how TCM can complement Western medicine in pain management, rehabilitation and palliative care.
We will work together with all the Alliance Health physicians as well as the Western doctors to assess the patient's ability and also their biomedical index, and then decided in what conditions we can use acupuncture and what the frequency and what is the duration of the acupuncture will be treated to the patients.
From 2027, NTU's Chinese medicine students will also do a 13-week clinical rotation at Tan Tock Seng Hospital for 3 hours a week in their final year. This will get a new generation of TCM practitioners ready to serve a rising demand for treatments that mix Eastern and Western medicine. A 2022 survey found 1 in 5 adults use TCM and nearly 40% of them pair it with Western care. Currently, Tan Tock Seng Hospital offers a range of traditional Chinese medicine treatments such as acupuncture and cupping, but it hopes to better integrate these practices with Western medicine so they become part of a more holistic patient care plan, not just as an afterthought or something that the patients have to ask for later. The integrative medicine model being piloted at Tan Tock Seng Hospital is backed by its cluster NHG Health, which has submitted it as a proposal to the Health Ministry's regulator sandbox.
It could involve extending acupuncture to other areas. It could involve other techniques like twin or acupressure. It could eventually move into the prescription of herbal treatments as well. And I think we want to do this in a very regulated, a very controlled environment so that we can actually gather the evidence to show what works as well, what doesn't work, and ultimately that will actually guide clinical practice in future.
Prof. Seed hopes that this can pave the way for authorities to expand subsidies to cover more types of traditional medicine in public clinics and hospitals. At the moment, subsidies only apply to acupuncture for lower back and neck pain.
Now, another partnership announced at the Singapore Health and Biomedical Congress could see NHG Health working with DFI Retail Group to co-develop food and supplements for seniors. DFI runs stores like Guardian and 7-Eleven in parts of Asia. These products will be backed by clinical research, and they could be sold in these stores by 2026. Senior Minister of State for Health, Koh Poh Koon, says stronger partnerships across institutions and the community can add value to care experience and health outcomes.
These initiatives exemplify the collaborative approach, which is key to improving population health across Singapore. Achieving this vision demands strong partnerships across healthcare institutions, academia, industry, and community organizations. It is such collaborations that will shape the future of healthcare in Singapore.
And for more on how the use of traditional Chinese medicine in Singapore is evolving, we're joined by Teo Chun Yong, who is Secretary General of the Singapore Chinese Physicians Association. Chun Yong, welcome to the show.
Yeah, hello everybody.
Now, first of all, let's talk about how the demand for TCM has changed in Singapore over the years. Do you see some treatments actually gaining popularity and demand?
I guess there's actually quite a fair bit of for in clinics, right? One of the key things that we've seen is actually for the treatment for chronic pain. I mean, besides lower back pain that was actually mentioned earlier, there are also pains in other areas like stiff necks, let's say where there are conditions whereby you have sprain the ankles, etc. So actually TCM is actually quite effective for all these sports injury, etc. Besides all these acute problems, we also have seen TCM treatment gaining popularity in areas such as fertility, as well as for the treatment of cancer. Yeah, because there are quite a fair bit of cases whereby what we are trying to do is to actually maintain the patient's quality of life, so as to, although they may be actually at late stage cancer. So even if they're actually at late stage cancer, we still try to actually maintain a very good quality of life for them until actually they eventually pass on.
Yeah, and it seems like it's quite a wide-ranging kind of application for TCM here in Singapore. Are there certain types of patients you tend to see becoming more and more open to TCM?
I think one interesting thing I've seen when I actually have clinics is that I've seen more and more Indians, Malays, even migrant workers who actually come and see us for various reasons, etc. Sometimes it can be like migrant workers who suffer a workplace injury. They're actually on light duty. So they actually come to see us for the management of their pain, as well as to improve their conditions, so they can get back to work faster.
Yeah, so as more and more people start embracing TCM, can you share with us some examples of how practitioners are starting to modernize their approach towards TCM, and especially for people who are also just getting acquainted, as you mentioned, to the medicine?
Okay, so one key thing that we've seen is that we tried to do, for example, at the Chonghua Medical Institution that's actually established by association, what I've tried to do is to actually use modern diagnostic tools to actually do like tongue examination, pulse examination, as well as to do some form of thermal imaging. So the objective of doing all these things is to provide more objective evidence in supporting TCM treatment, in so-called advocating the effectiveness, explain the so-called evidence base, because we actually have been answering the call of the government to actually have more evidence-based medicine, to practice more evidence-based medicine.
Yeah, and that call also would be in response to the growing demand for TCM treatments as well, especially in the hospitals, as we've just heard from the story earlier. How do you see TCM complementing Western medicine? How do they come together?
Yeah. Okay, so I think one key thing we need to differentiate is that for TCM as well as Western medicine, right, they actually operate on very different so-called principles. So, for example, let's say you have a running nose. If you go and see a Western doctor, right, most likely, if let's say you have 10 patients presenting the same symptoms, right, all of them will be given antihistamines. But if you go and see a physician, most likely there's a high chance that the 10 patients will be given 10 different prescriptions. So I guess that's one of the key things that we need to understand between the differences between TCM as well as Western medicine. Because for TCM, we're actually highly personalized. So I guess our strength also lies in the case whereby if we are highly personalized, we actually have the ability to also treat based on the presenting set of symptoms. We call it syndrome. Without having doing a lot of like guesswork, exactly what like virus or what actually problem is actually causing the disease, the state of disease that's presenting at the patient's current state.
Yeah, especially with the help of the diagnostic tools that you mentioned earlier as well. So in this case, for traditional Chinese medicine's applicability in wards and in hospitals, how do you see that personalized approach actually applying more effectively to the care of patients in these wards?
Yeah, so I think one of the things that, so for one thing for sure is that as even, let's say for World Health Organization, they actually acknowledge that acupuncture actually works for a lot of elements. I guess the challenges for World Health Organization is in terms of like, because of the personalized nature of TCM, especially for herbal prescriptions, right, it may be difficult to actually find the objective evidence to the standard of randomized controlled trials that is usually demand of Western medicine. So I think one thing good, as what Prof. C has mentioned in his video, that it actually provides a more objective, so-called objective environment for us to present more so-called objective evidence to actually support the use of TCM in the treatment of various conditions, etc.
I'm also curious what the response has been like when you work with doctors who are trained in Western medicine.
Yeah.
How have they been able to kind of incorporate what they're learning from TCM and vice versa?
I guess one of the key things is that we have more room to promote better understanding between TCM physicians as well as Western doctors. I think, for example, amongst Western doctors, I observed there's a very common misconception that TCM physicians like to prescribe steroids. Yeah, I guess I think the challenge is because we don't really differentiate between traditional Chinese medicine prescribed by a practitioner versus traditional Chinese medicine that you just buy from unknown sources. So just to clarify, I think for TCM, it's not really TCM. Let's say, for example, there is actually a certain condition like lower back pain, and you just go to a like herbal shop and the person just recommend you a standard so-called prescription. That is, in a way, Chinese medicine, but it's not really TCM practice. Because TCM practice we have to go through the 4 diagnostic method where we will actually record down the clinical history of patients. We actually have to see the tongue, examine the pulse, etc., before we make a very holistic assessment of the general state of the patient. So I think one of the key things that we are trying to do is to promote better understanding between Western doctors as well as Chinese physicians. I think for TCM practitioners, one thing we also need to note is that what are the cases whereby we will need to having these conditions urgent, probably we actually need to refer the patient for hospital care, for example. There are actually cases whereby I observe that the pulse is not very right, and maybe the patient will need to visit the cardiologist.
Yeah.
So I mean, in the event, I was quite happy that I was right, whereby I referred back the patient to the cardiologist, and eventually it was found that he needs a stent.
Yeah, it's a very collaborative effort
Yes.
at the end of the day. It's not about one, technique or one practice being better than the other. And also the patient benefits from both
Yes.
coming together as well. Speaking of the misconceptions, that you mentioned earlier and the difference between TCM practitioners and just Chinese herbal medicine, for example, what kind of policy changes or anything new that can be implemented would you say might help with further recognizing TCM as a very legitimate form of treatment?
I guess I think one thing which we have been actively trying to do from our association and together with the Academy of Chinese Medicine, even NTU, etc., we start to see increasingly more and more of these forums whereby Western doctors as well as TCM physicians get together, where we actually sort of like help to clear up actually misconceptions and a lot of all these things. I'm not actually for that we actually try to change everything overnight and say that, you have to accept TCM, etc. I think what we could do more is actually find common grounds whereby we can work towards our common good patients. After all, actually, even for WHO, they actually did a lot of studies, etc. And I think they already identified quite a fair bit of basket of elements where actually traditional Chinese medicine can be proven to be possibly effective. So I think that these elements are the place where it's a good start for us to do.
And also, having both practices come together in places like wards, all that is definitely a great starting point.
Yes.
So thank you so much, Chun Yong, for coming in today and for sharing your insights with us. I've been speaking with Teo Chun Yong, who is Secretary General of the Singapore Chinese Physicians Association.